Historically, as plastic surgeons, we looked at aging faces and saw laxity of the tissues. The classic correction for this was to do lifts and tightenings of the tissues, brow lifts, face lifts, and that sort of thing. Recently, though, it's become increasingly recognized that the problem may not always be from loose tissues, but from volume loss. Studies have now conclusively shown that as we age, the face undergoes bony changes such as enlargement and elongation of the orbit, as well as actual loss of fatty volume. This is frequently seen in the area under the eyes and folds from the base of the nose to the corners of the mouth, also in the temporals and lateral brows. These changes can even be seen in patients in their 30s, and virtually everyone develops volume loss over time. One obvious solution to correct this volume loss is to restore it. This initially was done with off-the-shelf fillers such as Restylane, Juvederm, and Sculptra. These fillers have their limits, however, and often have to be re-injected over time. One of the hottest new developments in plastic surgery has been the use of a patient's own fat to restore volume to the face. Increasingly, plastic surgeons are using fat as a natural solution to volume loss, often in conjunction with other classic surgical procedures such as eyelid surgery, brow lifts, and facelifts. The use of fat to restore volume can often result in needing to do less aggressive lifts. Many surgeons have found that using the combination of Botox or Dysport and fat grafting to the brow has significantly reduced the number of brow lifts they do. The placement of fat grafts in the face is technically challenging. It requires significant expertise on the part of the surgeon. Be sure to see a surgeon who is certified by the American Board of Plastic Surgery, and don't be afraid to ask how many of these procedures he or she does. Ask to see before and after photos. There can be prolonged swelling and bruising associated with fat grafting to the face, and expect that about half of the volume placed will remain long-term. As far as we can tell, the fat that is grafted, since it comes from the patient themselves, is very long-lasting, possibly lifelong. If you are considering facial rejuvenation surgery, be sure to discuss the option of facial fat grafting with your surgeon. A more natural correction of the underlying problem, fat loss, will hopefully result in a more natural appearance and long-lasting result. For the Plastic Surgery Channel, I'm Dr. Bruce Van Natta.